this past summer when I was working as a hospitalist. I'm a 50-something-year-old man who was working as in construction, came to the hospital one evening, like a Friday evening, because of chest pain. He had been having chest pain on and off for a month, he said, and he was trying to just get around it, just work through it, try to ignore it, just get through his working season, which is the summertime, so that he thought that he could save up enough money to go and have some sort of treadmill test or stress test so that he could have a diagnosis about his heart. And finally, he came to the hospital because he just had a severe episode and he couldn't stand it anymore. He thought he was going to die. That he had no health insurance because his boss couldn't afford health care for his workers, which is an all too frequent story for small businesses. In any case, the end of the story is he was in the hospital, and then on the weekend, because I work primarily on weekends, and so he had his treadmill test the next day, so he had the privilege of incurring a medical debt that he knew he was not going to be able to pay. So we all wound up paying for this because the hospital writes off that debt, which means that in order to stay afloat, they charge everybody else extra.